Ghana, a proud country in West Africa. Since 1922, the Salvation Army as an international movement has operated in Ghana and is involved in various sectors of the health services. One center of the Salvation Army is located in the village Agona Duakwa and has the name Community Rehabilitation Project, briefly CRP. Currently, Mr. Ato Hayford is responsible for coordinating all activities in this project, which is fighting for the integration of people with physical disabilities. He is working together with a team of social and rehabilitation workers. Furthermore, the project has a therapy room where disabled children are practicing special training. And there's finally an orthopedic workshop which is making various assistive devices such as special shoes, special chairs or calipers for disabled persons. These devices are also used for the physiotherapy. This Community Rehabilitation Project of the Salvation Army tries to realize the vision of include all people in the society in the following way. The first out of 3 steps is education about health and disabilities. During some special community assemblies, the CRP informs about prevention and an understanding of disability called public education.
The faith that disability is as a result of a punishment from the gods among the Ghanaian populace is widespread. But disability is purely a medical thing, especially cerebral palsy, which is caused as a result of brain damage or lack of oxygen during labor, which normally restricts the movement of the children. So it is not as a result of punishment from the gods.
With trained volunteers and special outreach teams, the CRP tries to reach all people in South Ghana.
Community volunteers playing a vital role in educating the communities in the villages on health-related issues and disability issues, especially children who are very vulnerable, who are hardly and affected by disabilities. Their role as community volunteers is very important. They also do mobilization. They help our outreach team in mobilizing the community before the team arrives in the community to render rehab services. So they are doing a great job for us.
The second step is help with therapy. Most of the physical disabilities can be trained and most deformities corrected through special exercises. One example for help with therapy is a 4-year-old boy, Nana Kwame.
Nana Kwame was brought here about 3 months ago. We're not able to walk. And then we did the exercise, daily exercise for him. And through the exercise, he started to walk. But before he can walk, we use the calabash to walk on it for about 1 month. And then through that, we made the caliper, boots, and then crutches for him from workshop. By now, he's doing well to work on the carica and the crutches.
And the third part, help with empowerment.
One major part of the work we're doing is to help people, especially children with disability, to get free access within their own environment. Disabled children are helped with the building of ramps into their homes and their rooms. Sometimes we do it in schools too for them to get access to education. They also help through vocational training to get skills so that they will be empowered and integrated into the society.
For example, the rehab center in the capital of Ghana offers vocational training.
They are learning how to mold the shoes, sandals.
We connect all these children to the schools for them to be empowered, socially empowered, economically empowered too, so that they don't become dependent on society and on their families.
Also, Isaac Alabo completed a vocational training. Additionally, the CRP supported him in building an own shop for him. And so, he is now a recognized tailor in spite of his disability.
I'm feeling comfortable. So, now I'm some person again say, but say, I'm responded the court again. So, the person says, and I say, yeah, that's my future.
Even the last 3 years, 1,361 people received assistive devices by the orthopedic workshop and are today doing well in the daily challenges and necessary activities. Furthermore, exactly 2010 disabled children were able to refer to special schools or vocational training. Inclusion of people with disability is our destination. Since 1985, we are trying our best, but we need your support.
By the nature of the CRP work, we solely depend on donors, with 20% income or support from the local resources, but mainly 80% comes from external donors, and these are used to run the project in helping people with disabilities, especially children, to get vocational training, formal training, going for surgeries.
The rehabilitation project in Duakwa requires approximately $120,000 in a year. But if there are 100 people who will spend for 1 year every month $120, the CRP could continue its work for another year. Who is really the helper? The donator. The CRP Duakwa is only the tool which converts this money and help and quality of life. Our request to you, become one of the 100. Otherwise, please become one of the 100 and make a better life for children with disabilities possible. Yes, it is possible.